Yes, I can do that. So I'll give you like my 1 minute rundown, quick reference guide to what the cycles approach is, who it's for, um, simple terms. Okay, so in a nutshell, the cycles approach is a phonological intervention that was developed like in the 80s or 90s by Dr. Barbara Hodson and colleagues to address moderate to severe phonological deficits among like preschool age children. So these are the kids who are highly unintelligible, moderate to severe deficits, lots of phonological patterns going on. And it was designed basically to, instead of like those articulation approaches where you just do one phoneme at a time, you cycle through different phonemes that you're addressing in order to remediate those phonological patterns that the child is exhibiting. And it was just a more expedient way to improve these kids' intelligibility. Another great thing about it is it's easily adaptable for maybe kids with cognitive deficits too, because you just double the amount of time that you're spending per phoneme, for example. So it's called cycles because you basically just kind of cycle through all the patterns and phonemes you're going to address with that particular child. Because you don't stick with one sound until they have it like at 80 or 90% accuracy. You spend a certain amount of time, 60 minutes, on one phoneme within a pattern you're addressing, and then you move to the other. You don't wait for a certain criterion or percentage of mastery before you move on. You just keep cycling through. So to start out cycles, you figure out all the patterns the child is exhibiting. You select primary patterns, and there are primary patterns within the approach of cycles, like syllableness. So if a child is only producing one syllable and not marking each syllable in 2 to 3 syllable words, you address that. Then you work on initial and final consonant deletion, S clusters, fronting or backing, and gliding as well. So those are considered the primary patterns you address in the first cycle. So once you've identified the patterns you're going to work on, you select like 2 to 6 phonemes within each of those patterns that you're going to spend 60 minutes on. So let's say if you're working on fronting, you are going to choose final K as one phoneme target, initial K, initial G. So those are 60 minutes on each one of those individually. So for 60 minutes, you're going to pick like 4 to 6 target words. That's it. You only have 4 to 6 target words with final K. Hawk, bake, mic, and those are the words that you're going to work on for 60 minutes. And then each therapy session is designed so that you have a couple minutes of auditory bombardment with amplification, where you're reading a list of words to the child while they do something quiet. You introduce the words, you get lots and lots of practice, you introduce maybe a metaphonological activity, and then you probe the next sessions or the next week's phonemes that you want to address to make sure the child is stimulable for those. Because with cycles, it's different than some other phonological approaches where you might target non-stimulable sounds. With cycles, you target stimulable sounds. So you're always kind of probing to make sure that you can get the child to be stimulable for whatever you're going to target next, which is really why it's a great approach for those kids who need to feel successful early, who might be hesitant in therapy, because you're not really making them do something that they can't do, that they have to really be resilient for. So it's great for kids who are a little bit hesitant in therapy first. And I think that's about it. I guess let me know if you have any questions specifically about cycles, and I'll try to answer some maybe tomorrow. Okay, lots of great questions about the cycles approach. I'm going to answer as many as I can. Research has shown that not just with cycles, but a lot of phonological interventions, generalization can be achieved with just working on a few target words. So those primary patterns are what Dr. Hodson recommends focusing on during your first cycle. Once you complete that, you can start adding in other phonological patterns in subsequent cycles. Yeah, minimal pairs is really for those kids with few phonological patterns, mild to moderate deficit. Cycles is more for kids with severe deficits who show many consistent phonological patterns. Phonetic context is extremely important for target selection. So if you're working on gliding, you want to pick words that have front vowels or open vowels to reduce or help reduce the occurrence of lip rounding. If you're working on fronting, you don't want to pick words that also have the air word sound in there. So you're not going to pick cat because there's an alveolar and a velar. So these are just some things to think through as you select your targets. The good news is I am developing several new decks for Bjorn's speech publications, specifically for cycles. So if you have trouble kind of thinking through how to select targets for specific phonological patterns to use in cycle, that's what's going to be coming out. S clusters, fronting and backing targets, and oh gosh, where's the other one? Oh, final consonant deletion, initial consonant deletion. So look for those to be coming out in the spring. Super excited about it. But if you need something like right now, I have my boom decks specifically for cycles that I've been using for my kids in person and over teletherapy. So check them out on Boom Learning or Teachers Pay Teachers. I'll put swipe up both of those here, but right now I have fronting. I'm looking right now. I have fronting deck, consonant clusters deck, a final consonant deletion deck. I also have an initial strident. So for those kids who were stopping, if you've already addressed S cluster, then you go into stopping. That's a secondary pattern. I have that one. And today I finally put up my gliding deck. So it's finished and live and you can go check it out. They also come with like auditory bombardment cards. Like it's legit for the cycles approach. So go check those out. My goals don't change based on the approach I'm using. I always just write the goals to the skill that I want the child to acquire. I have a post on it. I will link it in the next slide. We'll start with nasals, M, N, and then final voiceless stops. So we don't do voiced stops in final position because we don't want to teach that intrusive schwa like bed. We would teach hat. If the child does not understand the syllableness of words, if they just are monosyllables, they produce monosyllables, you choose like 2, maybe 3 syllable word or target words or phrases like cowboy, cowboy hat. We don't really work on weak syllable deletion with cycles because we're working on those patterns that are going to improve intelligibility. Weak syllable deletion is not one of those that really impacts intelligibility a whole lot. So we're not going to work, if they're saying nana for banana, we're not going to work on that. Just whether or not they can repeat it after you. If they're not producing it in their spontaneous speech or they're not producing it when you give the assessment, have them look at your mouth, see if they can copy you. If they can copy you, then they're stimulable. If they're not stimulable yet, what can you do to get them to be stimulable? Verbal cues, visual cues, tactile cues, proprioceptive cues. No. In short, no, it's not okay. So what can you do when that child is inaccurate? If they can't produce the sound, stop them immediately and give them the cues or the prompts that they need to be accurate. No, you work on multiple patterns throughout the cycle, but a cycle can be like 15 weeks long, depending on how many patterns you're addressing and how many phonemes you address. Because in a 60-minute period, you're addressing one phoneme within a pattern. Yes, 100%. This is a super adaptable approach. If you can only see, sometimes I only see the kids for 30 minutes once a week, but I'm training parents to work on it at home so that we get that 60 minutes in. You can do groups, super adaptable.